Hello my dear viewers, welcome to my channel The Vinay Voice. So today we are going to discuss about an important LAQ from the head and neck, that is the thyroid gland. So what is the thyroid gland? It is a shield form like structure which is present in the neck region. So it is the largest endocrine gland of the body. Why? It is named as endocrine gland because it will secrete some amount of the T3, T4 and the calcitonin hormones. So these hormones will play a major role in the body metabolic functions. So this T3 is also known as triiodothyronine. The T4 is also known as thyroxine, and the third one is the calcitonin. So this is the introduction part which you should write in your examination. And next, we are coming to location. See, the yellow colored one is the thyroid gland. It is located at the lower part. This is the lower part of neck, and this is the side of neck. So it is located at the lower part of neck in front and the side of neck. So lower part of neck of front and the side of neck, and opposite to the C5, C6, C7, T1 vertebra. How to remember this? Please listen carefully. In the gland, how many letters are there? 5 letters. G-L-A-N-D, gland, 5 letters. That means it will start from C5. Remember, in the gland there are 5 letters. That means it will start from C5. In the thyroid, how many letters are there? 7. That means it will continue up to C7. What is the first letter here? T. That means T1. So it will end up at the level of T1. Right. So this is a mnemonic by which you can remember the exact location of the thyroid gland. Right. Next. Parts. See here how the thyroid gland is there. Simply you can say that it is a H-shaped like structure. It is an H-shaped like structure. So these are the two lateral lobes of the thyroid gland. How they are connected? It is connected by a structure. This is known as isthmus. This is known as isthmus. So if you draw a midline, you can observe that there is a small structure which is arising left to the midline. It is known as pyramidal lobe. This is known as pyramidal lobe. So this pyramidal lobe is connected to the hyoid bone by a fibromuscular band-like structure that is known as levator glandulae thyroideae. That is known as levator glandulae thyroideae. So let's recall once again. Head-shaped right and left lateral lobes, isthmus connecting them across the midline. Pyramidal lobe projects upwards from the isthmus, usually to the left of the midline, and you can say about the levator glandulae thyroideae. So it is a fibromuscular band-like structure. Next, capsule. See in this picture, how many capsule you can find? True capsule and a false capsule. So which is the inside? True capsule. Which is the outside? False capsule. Simply. So this thyroid gland will contain two capsules. Those are true capsule and the false capsule. The true capsule will be inside. The false capsule will be outside. Simply. So how this true capsule has been formed? This true capsule is formed by the peripheral condensation of the fibrous stroma of the gland. What is meant by fibrous stroma? Fibrous stroma means it is a connective tissue. So when this connective tissue undergoes peripheral condensation, it leads to formation of the true capsule. And next, false capsule. How it is formed? It is derived from the splitting of the pretracheal fascia. So what is meant by pretracheal fascia? It is a fascia covering the thyroid gland. Simply you can remember that it is a fascia covering the thyroid gland. So when this pretracheal fascia undergoes splitting, so it leads to formation of the false capsule. It leads to formation of the false capsule. Right? So there are two capsules. Next, relations. What are the relations of the thyroid gland? We have apex, base, 3 surfaces and 2 borders. So the borders can be remembered by the mnemonic AP. A means anterior, P means posterior, and the surfaces you can remember by lamp, LA, lateral, M, medial, P, posterolateral. I repeat, A stands for anterior border, P stands for posterior border, L lateral, M medial, P posterolateral. So with this mnemonic you can remember the relations of the thyroid gland, right? Next, see in this picture. So this is the outline of the lateral lobe. That means this is the apex region. The important point you should remember here that the muscles attached on the oblique line of the thyroid cartilage. So what are the muscles are attached? Those are sit muscles. Which muscles? Sit muscles. S stands for sternothyroid. I stands for thyroid. T stands for inferior constrictor. So with this remember, with this mnemonic you can remember the muscles which are attached to the oblique line of thyroid cartilage. Which muscles? Sit muscles, right? So the apex is directed upwards and slightly laterally it extends up to the oblique line of the thyroid cartilage. Next, see in this picture. So this is the which muscle? Inferior constrictor, right? So it is which side? Medial side. The medial side there is one muscle, inferior constrictor, and the lateral side. What is the muscle? Sternothyroid. Sternothyroid. Which side it is? Lateral side. So this is the apex of the thyroid gland. Hence I can say that the apex of the thyroid gland is sandwiched between the inferior constrictor and the sternothyroid muscle. Sternothyroid muscle. How you can remember? C. IC stands for inferior constrictor. M medially. A means apex. S. T means sternothyroid. L means laterally. So the inferior constrictor medially, in between that there is apex, and sternothyroid laterally. So with this mnemonic you can remember the apex relations of the thyroid gland. Next, base. Base. See here I highlighted the two regions. The first one is the inferior thyroid artery. See here, this is the inferior thyroid artery, and there is one, the yellow color, recurrent laryngeal nerve. So these are the two structures related to the base of the thyroid gland. How to remember? ITAR lane. IT means inferior thyroid artery. ITAR, inferior thyroid artery. RLANE. R means recurrent. LA laryngeal. NE nerve. I repeat, ITA inferior thyroid artery. ITA inferior thyroid artery. R means recurrent. LA laryngeal. NE means nerve. So inferior thyroid artery and recurrent laryngeal nerve, right? Next, lateral surfaces. We have the rule 4S. What are the 4S? Those are sternothyroid muscle. This one is the sternothyroid muscle, and this one sternohyoid muscle, sternohyoid, and this one superior belly of homohyoid, superior belly of homohyoid, and this one is the sternocleidomastoid. So these are the four surfaces which are related to the thyroid gland. Okay. Next, medial surface. In the medial surface, you can follow the two rule. What is meant by two rule? See here, there are two muscles, two cartilages, and two tubes. What are the two tubes? Trachea, esophagus. This is the trachea, this is the esophagus. And two cartilages. What are the cartilages? Thyroid cartilage and the cricoid cartilage. This is the thyroid cartilage, this is the cricoid cartilage. And next, two muscles. What are they? Inferior constrictor, this is the inferior constrictor, and the cricothyroid muscle. Cricothyroid muscle, this is the cricothyroid muscle. So in the medial surface you should follow the two rule. Next, posterolateral surface. What are the structures of the posterolateral surface? See this green colored line, it is the carotid sheath. So this carotid sheath will contain the internal jugular vein, the blue color one, internal jugular vein, common carotid artery, the red color one, and the vagus nerve, the yellow color dot. So these are the three structures which are related to the posterolateral surface of the thyroid gland. So how to remember? VIC. V means what is the structure? Vagus nerve. I means internal jugular vein. C means common carotid artery. So with this mnemonic, you can remember the posterolateral structures of the thyroid gland. Next, anterior border. How to remember the anterior border? See in this picture, anterior branch. So where this anterior branch will come? The anterior branch is arrived from the superior thyroid artery. So the relation is A means anterior branch. SAT means superior thyroid artery. ASAT. The anterior border is related to the A means anterior branch. SAT means superior thyroid artery. Okay. Next, posterior border. How it is related? See in this picture. This is the superior thyroid artery and this is the inferior thyroid artery. So this superior thyroid artery and inferior thyroid artery, they are anastomosing at this point, right? So this is the relation, arterial anastomose between the superior and inferior thyroid arteries and the parathyroid gland. You know that the thyroid gland will contain the 4 parathyroid glands. So those are the relations which are related to the posterior border of the thyroid gland. So that's the thing. Superior thyroid artery and the inferior thyroid artery, that anastomosing region along with the parathyroid glands. Right. So that's all for today. I would like to request you, my dear friends, to please subscribe a channel, hit the bell icon and drop a like and share to your friends. Don't forget to comment. Have a great day, my dear friends. Thank you for listening my Vinay voice.